Hello, my dear friends. Welcome back to another episode of the lecture series Complete Denture. Today, I am going to discuss impressions in complete denture. So, what is an impression? Actually, the impression making is the primary step in the process of complete denture fabrication. And the primary impression is made after the pre-prosthetic surgery is complete. And it is used to prepare a special tray. If the patient did not require pre-prosthetic surgery, then the diagnostic cast made from the diagnostic impression can be used directly to fabricate the special tray. And what is an impression? It is defined as a negative likeness or copy in reverse of the surface of an object, an imprint of the teeth, and the adjacent structures for use in dentistry. So, according to Glossary of Prosthodontic Terms, a complete denture impression is a negative registration of entire denture bearing, stabilizing and border seal areas present in the edentulous mouth. So this picture shows an excellent preliminary impression. So the impressions which are made to produce a negative replica of the patient's mouth into which plaster or stone can be poured to form a positive replica. That is the cast. So this picture shows the cast. Okay. And it acts as a template over which the CD is fabricated. And errors in impression making can lead to treatment failure. Okay. So impressions are the negative replica of the patient's mouth and the cast is a positive replica. Okay. So coming to the classification of the impressions. So impressions can be classified on the basis of theories, technique, type of tray, purpose of impression and the material used. So coming to the theories. So depending on the theories of impression making, it is classified into 5, that is mucostatic or passive impression, mucocompressive or functional impression, selective pressure impression, myostatic impression theory and dynamic impression theory. So coming to the technique of impression making, that is first one is open mouth technique. It records the oral tissues in a static state with displacement. Okay, and here the patient's mouth is in open position. Dentist applies controlled pressure on the inserted tray to record the tissues in a static form. The next is closed mouth technique. Here the oral mucosa is recorded in a functional and compressed form and the occlusal loading during impression making is comparable to occlusal loading during function. So it is indicated for atrophic ridges. Okay, so these are the 2 techniques used for impression making. Then coming to the type of trays. The various type of trays used in the impression making procedures are stock tray and custom tray. So these are the stock trays. It is available in various non-perforated and perforated trays, that is a metal tray, and it is available in various sizes also. Okay. So this is the custom tray. Here the maxillary tray, it has been trimmed and finished and the posterior extension ends at the vibrating line. So here the vibrating line is there and so the posterior extension ends at the vibrating line, and note that the handle which projects from the tray at approximately the angulation of the natural central incisors. So these are stock tray and custom tray. So next is depending on the purpose of impression making, it is classified into 3, that is diagnostic, primary and secondary. So one is diagnostic impression. It is actually an impression made for the purpose of diagnosis, treatment planning and fabricating diagnostic cast. And the materials used are irreversible hydrochlorics. Okay, then what is primary or preliminary impression? It is made for the purpose of making a preliminary cast on which a special tray is constructed. And the material used are irreversible hydrochlorics, impression compound, putty, heavy body elastomeric impression materials. And for the final or secondary master impression, it is for the purpose of fabricating a master cast on which the processes is fabricated. And the materials used are zinc oxide eugenol impression paste, impression plaster, medium and light body elastomeric impression materials. And finally, based on the materials used, it is classified into reversible hydrocolloid impression, irreversible hydrocolloid impression, then modeling plastic impression or impression compound, then plaster impression, wax impression, silicone impression and thiacol rubber impression. So that is all about the classification of impressions. Okay. So depending on the theory, technique, purpose, type of material used and type of tray used. Okay. So in the next video, we will discuss the theories of impression making in detail. Thanks for watching and please subscribe for more videos.